Good afternoon, everyone. We appreciate you joining us today. My name is Adam Mayberry. I'm the lead PIO for the incident management team that's responding to the COVID-19 pandemic crisis here in Washoe County. We're continuing to practice social media inside this media briefing room at the podium at a time. This is also our attempt to hold at least one weekly press conference each week on timely topics that we know are important to you as those that are reporting the news to our citizens. We're going to hear from the interim superintendent, Krista McNeil of the Washoe County School District. After her introduction, we'll open it to questions for a few minutes. She will then depart the room. We will introduce Julia Ratty. Julia is a representative with the county's health district, and she will discuss how we're meeting the needs of the homeless population and accommodating those who are impacted by the COVID-19 and require housing for isolation. We will also hear from the county's Washoe County Health District Officer Kevin Dick. We'll conclude from some remarks from our Deputy Incident Commander Scott Stevenson. I do also want to take a moment to better clarify for my friends and colleagues in the media just what an incident management team is and some of the acronyms that we use to better help you in your reporting. The government jargon and government speaks can sometimes be a little complicated, and there's been some misinformation on the structure of the ICS or Incident Command System and what that entails. And we will be providing you as early as tomorrow some material to help you better understand the structure, the function, some of the acronyms. Our incident management team is supporting Washoe County, the city of Reno, and the city of Sparks.
Jargon, government speaks, can sometimes be a little complicated. There's been some misinformation on the structure of the ICS.
Pardon me, as we troubleshoot something.
And we will be providing you as early as tomorrow some material to help you better understand the structure.
Okay, apologize for that. We kind of work through these remote virtual press conferences. It's new for all of us. But I do want to say that as part of our incident management team is a Joint Information Center, or a JIC, another government acronym. And these consist of our public information officers from multiple jurisdictions and agencies throughout Washoe County. We just ask that you be patient with us. We are inundated with a number of inquiries from not only the press but members of the public. We will respond to each and every one of them. I just ask you to be patient with us and give us the space because we want to be thorough and we want to be accurate. So. With that, I'm going to ask the superintendent of the Washoe County School District to come up and provide her remarks and take any questions. Which she's completed, we'll introduce Julia Ratty. Superintendent?
Thank you very much. Good afternoon. I'm Dr. Krista McNeil, Interim Superintendent for the Washoe County School District. I deeply appreciate the opportunity to update our entire community on our distance learning program, which started today. All of us at the Washoe County School District are working hard to continue to make sure education of our 64,000 students is front and center under these extraordinary circumstances. And I commend our entire staff, over 8,000 employees, who have created, produced, distributed learning materials both online and in hard copy documents across our valley. I'd like to remind our families that all of these printed materials, the identical materials, are available on our website at www.washoeschools.net. We encourage our families who do have internet access to download these pages if possible. Over the weekend, our print shop continued producing materials for distance learning. As of today, we have printed over 50,000 packets. Our bus drivers from transportation delivered them to over 36 sites across our valley. We have seen a large turnout of families, and with the help from the University of Nevada, City of Reno, Washoe County, and the state, We are in the process of creating more hard copy materials for our students. We appreciate all of our community's support in this effort. If our families do not have internet access, we will have enough materials for your students to use. We will be working hard to keep up with demand, but I want to assure all of our families that no one will be penalized if they receive materials after today. We will continue to deliver these packets of school materials until every student that needs one has one. As of today, you should have received a Connect Ed message from myself, letting you know that the schools will now be closed until April 30th upon notification from Governor Sisolak. And we truly appreciate the support of Governor Sisolak in making this difficult decision. Please stay well, Washoe County School District families and staff. Follow the directives of our health district. Stay home for Nevada, wash your hands, and maintain social distancing. We look forward to working with you through this difficult process. Oh, and any questions, please?
Okay, want to make sure there's no questions for the superintendent. Okay, thank you, Superintendent McNeil. We appreciate you coming up and providing an update for us. Pleasure to introduce Julia Ratty. She is an employee with the Health District who has been identified as the lead to address some of our issues unique to the homeless population. Her role has been to coordinate actions among the city, county, health district, and our nonprofit partners who work with this segment of our population. She's also worked directly with the Human Services Agency to develop the process for providing housing to any COVID-19 symptomatic or COVID-19 positive individual who is unable to safely isolate at home. And she'll have some remarks and be available for questions as well. And as most of you know, Julia Ratty is also one of Northern Nevada's state senators. In this capacity, she is representing the health district. Julia?
Hello, everyone, and thank you for the opportunity. I do have a brief written statement that I'm going to read to make sure that I get you all the information, and then we'll be available for questions. So our number one priority as a community is to flatten the curve on the spread of COVID-19. Alternative housing is an important strategy to assist our friends and neighbors who have COVID-19 symptoms or who have received positive COVID-19 test results and who, for many reasons, cannot safely isolate at home. We have a housing plan in place, and we have placed a small number of individuals to date. We anticipate an increasing need for this type of housing. Our goal is to reduce the number of individuals who are exposed to COVID-19 by rapidly housing individuals who cannot safely isolate. Currently, we have 2 housing options identified. The incident management team has secured trailers to build out general housing. Operations are underway to set up these trailers. They include individual units, which include a bed, a bathroom, and a shower. We expect to have 35 to 40 beds available to us soon. At full build-out, we would be able to house about 300 people. The incident management team is working to secure food service, security, staffing, and all other logistics necessary to house individuals here. Again, these are general housing units, which would be available to individuals who can successfully isolate on their own and don't have appropriate housing to do so. We also have access to 43 beds in 20 units of supportive housing. This contract includes 3 meals per day and support from a case manager and an advanced practice registered nurse. These units are reserved for individuals who need support to safely isolate. A team of professionals at the Washoe County Human Services Agency are lead on determining housing placement. This includes individuals who are accustomed to interviewing and assessing an individual and then providing them appropriate support. They have been tasked with receiving requests for housing and facilitating appropriate placement. Again, let me emphasize that the individuals that we will be housing will have COVID-19 symptoms or will be COVID-19 positive and will not have options for safely isolating at home. Many will be awaiting test results. Referrals will come from hospitals, the health district, area nonprofits, and through the COVID-19 call center. So that's the end of the update on housing specifically. Now I'm going to transition to where we are with serving friends and neighbors who are experiencing homelessness. So in addition to providing that housing to the general population, we have been working specifically to support members of our community who are experiencing homelessness during the COVID-19 pandemic. These efforts are laser focused on flattening the curve to reduce the spread of COVID-19. Yesterday, you received a written briefing on those efforts, so I'm just going to hit the high points. Washoe County Health District has been working with the Community Assistance Center, also known as the Homeless Shelter on Record Street, to provide guidance to reduce the spread of COVID-19. 18 Sandy Hut portable restrooms with hand sanitizer have been temporarily placed in a variety of areas throughout Washoe County. Bottled water is being distributed at the Reno Events Center and by downtown Reno ambassadors, and in the near future will extend to other individuals who are dispersed throughout the community. About a dozen hand washing stations will be temporarily deployed soon. We've been waiting to get past the freezing temperatures. And the City of Reno has worked with Volunteers of America, the operator of the Community Assistance Center, to open the Reno Events Center with 375 beds to accomplish better social distancing. Beds are spaced 6 feet apart, there's ample restrooms for hand washing, and clients are screened for COVID-19 symptoms before entering. The existing community center has rooms, a community assistance center has rooms with a bed and a separate bathroom to isolate those individuals who are experiencing symptoms. The Community Health Alliance medical professionals then screen those individuals, and if they are high risk for COVID-19, they are removed from the shelter and placed in alternative housing. Approximately 35 individuals and 20 families remain at the Record Street shelter. Families who are experiencing homelessness with children remain in individual units within the Record Street complex. Food service providers have moved from sit-down dining to boxed meals that can be taken from the premises, and everyone is working to manage the lines to encourage greater social distancing. Ambassadors and nonprofit field staff are out in the community distributing information to make sure everyone has the information that they need to stay safe and know how to access services. I want to end on a moment of gratitude. I want to take a minute to thank the many community heroes who are doing tremendous work at this time. I am proud to work with the professionals at the Health District, Washoe County, City of Reno, and City of Sparks. They continue to do the difficult work of making sure our community has access to critical services despite this emergency. There are social workers, health specialists, housing managers, administrative assistants, cleaning staff, and many others who have made sure that we as a community have the support and information that we need. I'd also like to recognize the amazing nonprofit and community partners and their employees who are still out there in the field providing services to vulnerable populations. Volunteers of America, Catholic Community Services of Northern Nevada, Reno Sparks Gospel Mission, the Community Health Alliance, Foundation for Recovery, Reno Initiative for Shelter and Equality, Food Bank of Northern Nevada, WellCare, the Downtown Improvement Association, and many, many others that I'm sure that I'm leaving out, have been on the front lines to help those in need. We owe them all a deep debt of gratitude. With that, I'm available to answer questions. So I think we're getting a question but can't hear it.
Can I ask a question?
Okay,
Yes,
thank you, sir.
please do.
Yes, I was curious. This is Brian Bayhuth with the Sierra Nevada Ally. What is going on regarding testing among homeless populations? And have people been identified with COVID-19 symptoms among those populations?
Great. Thank you for the question. So I'm going to take the second question first. So yes, there have been individuals who have been identified with symptoms. Every night in the Reno Events Center, the staff is screening every individual who comes into the Reno Events Center, and they are checking their temperature and they're asking them for symptoms. If they have symptoms, then they are escorted over to the existing Record Street shelter, In that shelter, that's where you can find those individual rooms with a bathroom and a bed, and they are housed there until the morning when the Community Health Alliance team comes in and screens them. If the Community Health Alliance team, which is medical professionals, believes that they are COVID-19 at risk, then we pull them out and get them housing, and we also get them lined up for testing at that point. So there are individuals who have been housed, and there are individuals who have been tested. The other way that folks might get access to testing is that they show up in the emergency rooms at the hospital. So we have also worked with clients who made it to the hospitals, were either in the ER or were admitted, and again, medical professional screening to determine who should be getting testing based on the same risk assessment that any other member of our community would receive. Are there additional questions?
This is Colo Tuchin. So the trailers that you have established at Edison and Mill, is there going to be security to enforce a quarantine, or what's the situation on that?
Great, thank you for the question. I appreciate the opportunity to clarify that because that is a question that we get a lot. So both with all of our friends and neighbors who can't safely isolate at home. So that might be an individual who's experiencing homelessness. It might be a college student who is COVID-19 positive, lives at home with mom and dad, but grandma is also there and has underlying conditions, and so they can't safely isolate there. So we could have various placements, some in supportive housing, some in general housing. Just like with the general population who is able to isolate safely at home, we don't have the ability to tell people that they can't leave. We are asking for cooperation. We are providing people supportive services so that they can cooperate. So again, in the supportive housing model, there's a caseworker there who would be working with individuals. But at the end of the day, if somebody decides that they want to leave, there's not a lot that we can do to stop them. It is our sincere hope, of course, that folks will stay. And certainly if we get the vast majority of people complying, which is what we expect, that will dramatically flatten the curve.
Hi, this is Jeanette Damon with the Reno Gazette-Journal. Thanks for answering some questions. I was wondering, how many people do you have in general and supportive housing at the moment? And is there any concern about supply? Like, do we have, we hear a lot about overwhelming hospital beds. Do we have enough housing for what we expect, any surge we expect?
So we just have a couple of people, and the only reason I'm pausing to give you a exact number is because there were folks being housed this morning as I left, and I don't have the final numbers on those, but it's going to be probably four or less. Currently, they are all housed in the supportive housing option because the general housing option, which would be the trailers, have not come online yet. Again, we have 20 units available in that supportive housing, 43 rooms. And so once we have multiple COVID-19 positive individuals, we could have folks doubling up in rooms. So we have 43 beds there. And then the other 300 should come online soon. We're hearing that somewhere between 35 and 40 will be released in the near future. So at this point in time, we do have adequate housing. Just like every other part of this pandemic, we are expecting an upturn. And so we are doing everything that we can to be prepared to make sure that we have additional housing. Are there any more questions? All right, thank you, everybody. I appreciate the opportunity.
Thank you, Julia. Would like to now bring up the Health District Officer, Kevin Dick. Thank you.
Good afternoon. I'm Kevin Dick, District Health Officer for the Washoe County Health District. And I'm sad to report that we've had our fourth COVID-19 death in Washoe County. The resident was a male in his 40s with an underlying health condition. On behalf of the Health District, we offer our condolences for the family and loved ones for this tragic death that has occurred. Yesterday, we reported 22 new cases of COVID-19 in Washoe County and 3 additional recoveries. That brought our COVID-19 cases in Washoe County to 143, our recoveries to 13. We have 126 active cases. We have 20 of those cases are residents that have been hospitalized, and we'll have an updated case count later today. I'm happy to take any questions. Are there any questions?
Hi, this is Jeanette Damon. I heard you earlier being briefed on the question I had submitted by email regarding your decision not to brief the incident command call this morning. Would you like to address that?
Yes, I was disappointed that I didn't have the opportunity to brief this morning because unfortunately the briefing that was a private briefing for me to provide updates on where we were, discussions that were internal deliberative processes in our response to this were made available. I was recorded without my knowledge that then appeared in the media. So I decided that since it wasn't scheduled as a media briefing, that I would not be providing that information in that format for the media.
Did you provide that information to the emergency commanders and others working on this crisis in a different format?
I'm not going to comment on that.
Is there a reason why you didn't want that information to be public?
I am not going to comment on that. Are there any other questions?
Who else, this is Siobhan from the RGJ, who else is doing testing? We've heard that St. Mary's is doing it, Renown is doing it, the health district's doing it. Who else is doing testing, and where are those tests being sent?
So we have various places in our community where testing is occurring. I believe you can add Northern Nevada Medical Center to that list as well. And the health district today conducted our first post. That was an expansion of the drive-through testing that we've been doing, where we collected samples for about 150 people was the plan there today. The tests that the health district collects are submitted to the state health lab. The hospitals are also submitting tests to commercial facilities, and I know that we have an effort. I can't give you the status today, but that Renown is working to establish a testing capability within their hospital as well. Any other questions?
This is Jeanette again. On a different topic, could you talk about the vulnerability of people in institutionalized settings, both healthcare workers, staff there, and residents, and what the health district is doing to address and any outbreaks in these kinds of settings going forward and currently?
So I think that everyone is aware, or most are, from news coverage, that within our institutional settings, we have in our hospitals increased risk for our health care and other care providers in those settings. And I want to express my gratitude and appreciation for their efforts every day to serve the needs of individuals in our community. Also in those environments, because of the age in some of the institutional settings, the proximity of patients to one another, there are enhanced risks for spread of COVID-19 if we have cases occurring in vulnerable populations. Those institutions in Washoe County are regulated by the State Division of Public and Behavioral Health. And so as we become aware of concerns in those facilities, we coordinate with the state on those matters. Any more questions? All right, thank you.
Thanks, Kevin. Would like to now introduce our Deputy Incident Commander, Scott Stevenson. Scott is also a seasoned firefighter. He's a fire captain for Truckee Meadows Fire and Rescue, and he'll provide a short statement and offer you a chance to ask him any questions pertaining to the status of some of the items that the team is working on. Captain Stevenson.
Good afternoon, Scott Stevenson, Deputy Incident Commander with the incident management team that's in place here. First of all, I'd like to give our sincere condolences to the families that have been affected by this outbreak, pandemic. The team continues to work with the cities and the county and the health district to provide both planning and logistical support during this response. That includes the housing that you've already heard about today, and such as things like PPE for first responding agencies and such. Thank you for allowing us to give you some information today. Is there any questions? Thank you. Good afternoon.
Okay, thank you, Captain. We appreciate you tuning in, and certainly we'll do our best to continue to communicate to all of our media partners. This is a very fluid and dynamic situation, so we continue to ask for your patience as we gather information and deliver to you for your listeners and viewers. Again, we have a website. It's a hub of information for our community, COVID19washoe.com. That's COVID19washoe.com. You can also follow us on Twitter, the same handle, COVID19washoe on Twitter. We are also mindful the governor will be addressing the state this evening at 5 and continue to encourage our residents to heed the advice of our governor, of all of our state and regional and local elected leaders, doctors and scientists, and to stay indoors as much as you can. Again, we will continue to provide you as much information as we can. We'll convene another press conference next Wednesday at 2 o'clock unless there's some breaking news that warrants a press conference before then. So, thank you all for tuning in, and have a safe and pleasant afternoon.